All right, I think we're going to get started. Can everybody hear me without the microphone? You can see the microphone's not set for me. I usually feel pretty tall with some round tires. I'm Alie. This is Tobias Newby. We're from UC Berkeley, and we're here. We're going to tell you about our transgender care team. This is what we're going to talk about today. First, we're going to go over just some terms so that we're all on the same page. We're speaking the same language as much as possible. And then we're going to tell you about how we've structured our team and why. And then we're going to tell you about the services that we're actually providing to students. And then we're going to have questions and collaboration. And especially the collaboration part, we're really excited about. We're really curious to hear what's happening at your schools, not only at the end, but during the whole presentation. Bring questions as we go. Hopefully we've allotted time for that. But before we start, a little disclaimer. Every good presentation starts with a disclaimer, right? Actually, I should tell you, the first disclaimer I should tell you is that before I came down here, I was having dinner with my family, and I was telling my kids about this presentation, and my 10-year-old said, if I get nervous, I should picture you all in your underwear. So that, just so you know, that might be going on. And then my 8-year-old said, no, you should picture crows on their head picking at their hair. I don't know where that came from. Hopefully there's no child therapists in the audience. But that might be going on too, that's just a warning. But the disclaimers about our presentation, we're a young team. Well, I'm not so young personally, but we're a young team. We're sort of new. We've been providing services to transgender and gender nonconforming students for a long time. But the way our team is structured and the way we're set up right now, it's pretty new, and we're still learning as we go. So we had one medical doctor, so the way our team is structured, and we'll get into this more, we have a medical side and a counseling side. We had one medical doctor providing hormones for quite a while, but then when that provider left, the medical side sort of took a breath and said, let's really think about how we want to structure services going forward. And that was in 2012 that structure really was put into place. And then on the counseling side, we had counselors who were doing therapy and doing assessments and writing letters for hormones and surgeries for a while before Tobias and I even came to Berkeley. And then right around the time that the medical side started to get organized, soon after that, the counseling side sort of said, let's stop too, let's take a breather, and let's really look at what we're providing, and let's get more organized. And that's when we sort of created our protocols and stuff that you all should have in front of you, and if not, there's a stack in the back. But we're just saying this because we want you to know that this is sort of where we are in our development. It's pretty new what we're doing. We're just really a few years in using this model, and we're not even really yet tracking it. Kind of where we are developmentally is we had these ideas and we put them down on paper and we thought, hey, this seems like a great, we're geniuses, right? We just thought of this great idea. But now what we're doing is we're really starting to assess our own protocols and our own assessments, and we're really on the cusp of that. We're just really getting into conversations now that everything's set. We're really getting into conversations about, well, how should we monitor what we're doing? How should we track it? How should we count students? How should we really find out if it's working for students? I mean, we're sort of getting anecdotal, we're getting sort of informal feedback from students that it's working, but really, we're not really fully assessing it. We're not really tracking it. And so the other thing that we're going to talk about as we go through this is sort of where we are developmentally in the process and where we're headed. And that's another reason that we want this to be a conversation, because we're certain that there are probably people in the audience here or at your schools that you're doing what we're doing, or maybe you've been doing it longer in certain ways, and so we want to hear from you all too. And the last part of the disclaimer is that we really want to give kudos to our predecessors. Tobias and I have been at Berkeley just a couple of years, 4 years. And there were people at Berkeley that were doing this before we got there. People providing counseling, people providing medical care. And there have been people working with transgender and gender nonconforming students for a long time that we want to give kudos to as well. And one thing in particular that we really want to highlight is what's going on at UC Davis in the counseling center. I did my pre-doc at UC Davis and then moved to Berkeley for my postdoc. And a lot of what I learned was through the UC Davis Counseling Center's transgender care team. And so it's really important for us that you all know that, there's a lot of history before us and a lot of folks that have helped us create this policy, particularly the policy that you see in front of you, the letter assessment policy. That a lot of that came from Davis, and then we sort of took it to our school and melded in ways that work better for what's going on in Berkeley.
And if I can throw in there also, we definitely want to give kudos to the members of our team who are transgender identified, and also the students on our campus who have really given us a lot of great feedback about our team and our services, because it's important that we hear from the community we're serving to make sure that we're really providing best practice.
We want to give you a little introduction so that you know a little bit about who we are and what about us sort of brings us to this work. And then we have a few questions for you all. We want to hear a little bit about you. So I'm going to turn over to Byers. Byers is going to introduce himself first.
All right, so my preferred gender pronouns are he, his, him. I'm an African-American male from North Carolina, identify as gay. I'm a cisgender male, which means the sex I was assigned at birth matches my gender identity. And those are some identities that I want to throw out there. And Laura's going to do the same. But I want to say the reason why we do this is because this work has really taught me and taught us that it's really important not to just accept cultural assumptions, but to really push our assumptions we have about ourselves, our own identities. As we look around the room, it can be easy to say, okay, this person fits this category, which of course helps us to feel safe and helps us to feel organized. But this work is really about pushing those and allowing the clients that we work with to be the experts of their own experience, really asking them, what gender pronoun do you prefer? How would you like me to identify you? What name should I use for you? And so we wanted to start with, sharing that example and starting from a place of vulnerability.
So the parts of my identity that are really salient to this work, I feel are that I'm a white cisgender woman. And so cisgender is, we're going to get in terms of a minute, but cisgender is a term that means that my biological sex matches the gender that I was assigned when I was born. So when I was born, the doctor who was there said, that's a girl. And that was based on my body, but that also fits my internal sense of myself. That lines up. I also prefer female pronouns, so that also lines up. And these are points of privilege, right? It's easier for me to walk through the world if all of these things line up. And that's something that I always hold when I'm going through my day in general, but especially working with trans and gender nonconforming clients. Another piece of my identity that feels very salient in this work is that I identify as a lesbian. And although gender identity and sexual orientation are different, for me they are very intertwined because I grew up in a very conservative area of the country that had very strict gender roles and very strict gender norms. And so, and there was a lot of homophobia. And so as a child, when my gender identity was developing, which develops before sexual orientation, gender identity develops before you're a sexual being. When you're 2, 3, 4, 5, 6, 7, you're really understanding who you are in terms of gender. When that was happening for me, I was identifying with all of the things that I wasn't supposed to identify with because I was a girl. The way that I wanted to talk and the way that I wanted to walk through the world, the way that I wanted to sit in the chair, the clothes that I wanted to wear, the activities I wanted to do, the toys I wanted to play with, they were all the things that boys were supposed to be doing. And so that really shaped me when I was very young, and it also really impacted my gender identity development. Tobias and I just had breakfast, and we just spent most of breakfast talking about how our gender identities are still developing because we're still getting to new places of feeling comfortable being who we are in terms of gender. And so that's very salient to the work that I do, and I bring that piece of me to the work. And it's also very important to say that I do not identify as transgender. I'm not trans. I have not done a transition socially or physically, and that's very important for me to hold as well when I'm doing this work. And both are true, that I do have some experiences struggling with gender identity and that I'm not trans, and those are things that we talk about a lot in our consultation team and that we bring to the work. So that's a little bit about us. So we want to know a little bit about you. So we want each of you to come up here and do what I just did. Just kidding. want to assume that what you know or what you don't know. So how many of you have worked clinically with a transgender or gender nonconforming client, or gender was the focus of the counseling that you did? Awesome. Okay, that's what we expected. Okay, and then how many of you have written a letter in support of a student pursuing hormone therapy or a surgery? Oh, wow. Okay. We thought there were going to be a lot of hands for that one. Okay. And do any of your schools have transgender care teams or a consultation team specifically to talk about trans issues? Yeah? What school are you at?
Oh, Davis.
Awesome. Okay. That's right. I recognize you now. Anyone else? Okay.
We have one at UCLA.
UCLA and Santa Barbara. Wonderful. Okay. We would love to hear what you all are doing. We're very excited about that. And how many of your schools provide hormones on campus to students in the medical buildings? Wonderful, wonderful, wonderful. So I know Santa Cruz. Santa Cruz. Any schools? UCLA? Okay, great.
I think we do UCI.
UCI? Okay.
Okay.
Okay, wonderful. Okay, great.
Yeah. So I'm going to move into the terms, and since there's some familiarity with, working with transgender and gender nonconforming individuals, I won't spend a whole lot of time on this, but one of my mentors who's transgender identified always said this, and this phrase really stuck with me and continues to stick with me in this work, and that language is fluid and contested. And for me, it helps me to hold lightly this terminology and say, okay, it gives me a base of understanding, but if I work with a client who says that doesn't work for me, then I'm like, okay, cool, I can let that go. Because I think when we're learning about working with different groups, sometimes we'd be like, okay, I have a basic understanding, so everybody kind of needs to work from that place. But I invite us all to hold these terms very lightly. Coming from North Carolina, when I moved to the Bay Area, I was like, I'm hip on queer, LGBT, I know what this stuff is. But just the language differences from North Carolina in the trans and queer population was very different than the Bay Area. So wherever we move up and down in California, across the country, one town over, it's really important to be open to how people identify. And it just seems to change. I'm always learning new things from students and from colleagues, like new terms that work for people and terms that might have been salient last year that are no longer really relevant for people. So I invite us as we talk about these terms to really hold them lightly. All right. So the genderbread person, I love this as a way to just understand the construction of gender. I'm sure some of you have seen this. I think it might be in version 3 right now. This is version 2 with some modifications that a person who was on our team did. So we have gender identity, which is the way a person sees their own gender, how they think about their self in their head. Gender expression, the way a person expresses gender. And this has a continuum from feminine to masculine. Then biological sex, the physical, chromosomal, anatomical markers that a person has related to gender identity and sex. And then sexual orientation, who a person feels romantically or intimately sexually attracted to. So we have this, and this has been really helpful for some of the students who I work with who are beginning to understand themselves as trans or gender nonconforming, because it gives them a way of saying, oh, okay, that's what's going on for me right now. So this can be a really helpful tool. I have it up on my cork board and sometimes point to it. And then I also invite students to say, okay, what parts don't work? What doesn't feel relevant to you? And please feel free to ask questions throughout, and make comments, because we really want this to be a dialogue between all of us. So, the umbrella term of queer. Now, when I moved from North Carolina, queer, that was a very uncomfortable term for me. I was like, I knew that was very pejorative for my community at one point. But then I moved to the Bay Area and started working at Cal, and everyone was like, hey, we're queer. And I was like, And I think some of this can be generational, because I know some people in the LGBTQIAA community who are older that I've spoken to are like, well, I remember and lived in a town where that really was a slur, so it doesn't feel as comfortable to me. But it seems that for largely younger generation of our community, that this is a term that's politically taking back a term that has been used to denigrate us, but now we're like, yes, we're queer, we love it, we're here, not going anywhere. So underneath, we talked about cisgender earlier, heterosexual identity, and underneath the queer umbrella, we use the term queer to cover many of these areas. But as we know with umbrella terms, they can never really speak to all of these things, so we just wanted to highlight these areas underneath here. Any questions about any of these terms that you see? Yes?
Polyamorphous?
Polyamorous, yes.
What is that?
So that is a person who has a relationship construct where they're not just monogamous. They're not just dating one person.
Got it.
They may be dating or sexually active with more than one person.
I just didn't know how that fit under queer.
I think for many people, given that it is not kind of the normative structure, like, you know, heterosexual, monogamous, you know, like if it doesn't fall under kind of what we're taught as a social norm, then sometimes it's seen as a queer behavior. And so some people might even be heterosexual but polyamorous and, you know, say that their behaviors or their community feels more queer than heterosexual.
Oh, yeah, I had a question.
Yeah.
The pansexual part. I guess my first instinct goes to pan. Isn't that in Greek experience? The like experience of this, where it's more the person, not necessarily the gender or the orientation, but sort of the connection and the experience with the individual. So it's more that the person is perhaps, it's kind of arbitrary until you really have that personal energy or draw to someone. Is that sort of what pansexual means?
Yeah, another term for that people use is omnisexual. So basically they can walk into a room and they don't need to say, okay, like for me, I'm a gay man, whereas other men, you know, they would say, I'm a person, these are people, where's the energy? Who feels attractive? Who feels attracted to me? I don't care what's, you know, in your clothes, I don't care what's your gender identity, just as a person, I feel attracted to you, and that's all that matters. And then asexual would be a person who doesn't necessarily feel sexual romantic attraction, but, you know, still likes to have companionship. The students I work with who are asexual are like, you know, I don't really feel the sexual impulse or that chemistry in that way, but I do just like to be with people. I like the social aspect of relationships as opposed to the romantic or sexual. Yes.
About intersex.
So intersex, we talked about that earlier. So intersex relates to the biological chromosomal features that would typically put a person in male or female. And so for intersex people, they don't fit biologically, and their reproductive organs might not look exactly like male or female. This will also be on the chromosome level, so maybe some XX, some XY. So it's not easily, you are biologically male, you are biologically female. And this has caused issues for some people who, you know, did have genitalia that you couldn't really tell, and parents have made a decision, okay, we're going to put you in this category. And then when the person grows up and realizes that they had intersex sexual development, they're like, oh wait, I had a choice and you like put me in this category that doesn't fit for me. And so that's why we have that. It's really important to keep that in mind. Yes.
Curious if you've heard of the term demisexual?
Demisexual, I have not.
Yeah, neither have I. I have until recently with a client who identifies as demisexual.
Ah.
And you know, I've taken a bunch of courses in my graduate training, got a certification on these studies.
Yeah.
And just like you were saying, you think you're on top of it, you know this, you know that, and then you get a term like that.
Yeah. And how did that student define it? How did they say, what did they say that meant for them?
Yeah, from my understanding, it seems very, very similar to pansexual, where it's not so much based on gender, but it's more fluid, very fluid, based on more of the person.
Gotcha.
Yeah, I was curious if you heard of that, because it was brand new to me.
Yeah.
I just started seeing this client. So.
Yeah, well, thank you for sharing that. And I mean, this is what's so important. This is how we help educate each other, you know.
I've heard it too, and related to what you just described. How it was described to me was pretty close to that. A little bit different was, sounded as though I need the presence of a romantic bond before I feel sexual. So almost like old-fashioned in a certain way. And it didn't have to do with gender of the partner. So I think in that respect it felt a little different than pansexual, where it's kind of like the hardware doesn't matter at all. It's just it was more like the order of things. Like I'm not just sexual, I'm demisexual. So if Cupid shoots his bow and music starts to play, then I feel sexual.
Okay, gotcha, thank you. And did you have something?
I did. I just wanted to clarify on the acronym of the LGBTQI. Is that part of
That's intersex. Yeah, so it's lesbian, gay, bisexual, transgender, queer, questioning, intersex. asexual allies. And then there could be others. I mean, I've seen it.
Tomorrow there'll be 3 more.
And that's why it's like largely, of course, again, not everybody, but largely at this point in time, accepted that queer kind of captures all. All right, and I did want to say something about questioning, because as I've worked with students who are questioning, I think questioning can have us in the mindset that, okay, so what's next? You're questioning, so then you're going to be here. But sometimes questioning can just end a person saying, well, you know what, I'm not really questioning, I'm just really fluid, so I don't need to have any particular destination. You know. And as Laura and I shared today, feel like we're always questioning something, you know. And so I think having that beginner's mind and being in a place of always learning and always evolving is really important. All right, thank you. All right, so now we're going to look at the trans and transgender umbrella. And throughout our presentation, you'll hear us say transgender, gender nonconforming, because it's really important for us that on our campus we've learned that some students who don't conform to the gender binary of male and female, but also don't necessarily identify as transgender. And so that's why we'll use that. But also as an umbrella term, trans with the asterisk, it refers to kind of covering a larger demographic. So transsexual typically applies to someone who is transitioned from one birth assigned sex, so it's more related to biological sex. M to F, a person who was born biologically or assigned, born biologically male, transitions to female. F to M, female to male. And this has been really important to us with gender nonconforming students because we have some students who were born biologically one sex and want to move away from that, but don't feel that they need to, you know, kind of do be an opposite gender or sex than they were. They just don't identify with the sex they were assigned at birth, but don't necessarily have to be on this end. And so in those situations, you know, as we'll get to writing letters later, it's really important to use language that fits for the student, you know, because a lot of the letter writing says, this person was born male and wants to transition to female. But as we're seeing, that's not necessarily what everybody wants. They're born male and want to just transition to gender queer or trans woman. And so it's really important to work with the student to find a language that works. Two-spirit is a term derived from some Native North American cultures, which represents a person who holds both masculine and feminine gender expression traits. And there are different terms in different cultures for this. Sometimes it's been called third gender, but it's just really important to be aware of whatever culture calls this as different things in different cultures. Gender queer, some students who work with identify themselves as like, you know, some days I might feel like using male pronouns, sometimes female pronouns, sometimes gender queer pronouns. Then non-conforming and gender variants. All right, we talked about this pronouns. It's interesting. I think this is something I, continue to remind myself to when I meet with students to ask what their preferred gender pronoun is. And it's really huge on our campus that when a lot of groups meet, that's how they'll begin their conversations. It's like, share what your major is, how old you are, and what's your preferred gender pronoun. Which is really nice. I had a student this last week ask me what my preferred gender pronoun was, and I was like, oh yeah, it's him, his, he. But I took a pause with that because I'm just not used to people asking that of me, which lets me know my privilege walking in the world presenting as people typically read me, But I really appreciated that student asking because it reminds me not to just get comfortable in the privilege of the norms that I align with. But here's some of the pronouns that we've heard. Some people, to be gender neutral, use they, them, their, ze, zir, zim, ze, here, hears. And it could be anything. Some people just prefer to use their name always in the gender pronoun space. And it could be work to reorganize our minds. But I think the biggest thing that I've learned from students is just that people are trying and acknowledge when they make mistakes is what's really important. Any comments or questions about this? Yes?
Is this embraced all over campus?
Oh,
The reason I ask is
Yeah.
I've never encountered someone asking what's your preferred pronoun.
Sure, pronoun, yeah.
And having gone to Berkeley many, many years ago, I don't, that wasn't
Wasn't
at
what's
all.
happening, yeah. I mean, definitely not all over campus. But I think the students that I have seen and worked with are really doing a great job of pushing this a lot more. I mean, they really challenge us as clinicians and both medical and counseling clinicians to really ask these questions and be thoughtful about that and to not make assumptions. So I think it's a growing movement, but there's still a lot of work that needs to be done on our campus. There's still students misgendered or misread by faculty or having their legal name instead of their preferred name read at the beginning of the semester, which can be really embarrassing and traumatic for a student. So not all over campus, but we're doing everything we can to make sure in the student health service that this is at least what's happening, and then we're trying to broaden that out as well.
So I work at UC Berkeley too, and just to follow up on that, I think particularly the students are pushing that movement in the residence halls when people are introducing themselves on their first hall meeting. Even in our new student services, as students are coming in for orientation, as well as in some of our ASUC student government. So I'm hearing when I go into spaces with students, that's one of the first questions that they'll ask: what are your preferred pronouns? So I think that some of the staff are catching on, but we still have work to do.
Something that I appreciated at UC Davis, one of my friends who identifies as transgender from female to male, he wanted to change his name from Alie to a different name and a more male name, and the fluidity in terms of going from that on his I have to transition with the identification as well, with the ID card and changing that on the ID card, because the first thing, and I wonder how the DMV would respond to transgender folks or any the pronoun that you have on the ID card being M or F, and would it be O for other, or would we have other letters that would identify with other things? I wonder how that would, that's your ID card right there, and that's a pretty big piece. So it's interesting.
Yeah, absolutely. And related to ID cards, we put this up here because Verifax on Cal's campus, this is where students go if they want to have their name changed on their IDs, and it's pretty, from the students I've talked to, it's a pretty easy process. It was like, hey, I want to change my name. And that doesn't mean that off campus their legal name is changed in any way, but at least on campus they can show the appropriate ID. And in our health service, we have ways on our electronic health record to note that. But yeah, it is difficult, and especially if there's somebody gender nonconforming who doesn't want to be male or female, then it's like, there's not, I look on websites all the time, like very inclusive websites that still will not have another option other than male or female, And doing this work has really trained me to look at my own biases, and also just to look around in the world and how people go through the world, and how we just really, we have these boxes and these norms that we don't allow a lot of space in, And so I think for both of us and for the people on our team, it's really important that we always kind of unpack our privilege and say, there's another example, what ways am I kind of perpetuating some of this stuff as well? Right, thank you.
I think that it's important to say also that that's a safety issue. If you're pulled over by a police officer, or your ID is, if your identification is in question, or you're having an issue with an officer, and then you present your driver's license, it could just raise even another level of concern for that officer, depending on what's going on and who you are and the interaction between you and that officer. If you present an ID that doesn't look anything like you. So I think it's also a safety issue, and we actually have in our thing, we have one example of a letter. It's just a letter in support, just saying this person doesn't match their ID, but this is what's going on. This is who this person is. If they present you with an ID with this name and this gender, this is still this person, and we can provide that letter so they can carry that in their wallet. Okay, so we're going to tell you about how we've structured our team, and then we're going to tell you about services offered. And I'm noticing time, so I'm going to go through this piece sort of quickly, although it's still open to questions. And then Tobias is going to walk you through the policy that you have in front of you so you know exactly what students are actually getting. Again, this is the way we have the team structured right now at this point in our team's development. And I can already sort of anticipate there might be some changes coming down the road, and I'll talk to those as we go along. But basically the way we're structured right now is we have three sort of sub-teams, three actual groups of people that meet. We have what we're calling a leadership team, and then we have a clinical care team. So these are all the folks that actually are with students. And then as a mental health team, we realized we really want to meet independently as well. So right now, 3 different teams are meeting. The leadership team addresses, so the way it's set up at UC Berkeley is all of everything medical is in one building. So everything from optometry, physical therapy, primary care, counseling, psychiatry, we have a social services department, another counseling department. It's all in the same building. So it's easy for us to collaborate, which is great. And so the leadership team has sort of one person from all of the main entities. So we have, how do you like our acronyms? You guys know what this means, right? So we have one person from primary care, one person from, why we don't call ourselves CAPS, I don't know, or CPS, Counseling Psych Services, which is me, I sit on that team. And we have one person from social services, which is what we call SOS, that's Tobias. That's another counseling department that has social workers, and they're special experts in certain areas. And then we have someone from health promotion, the health promotion office, which is also in that building, which is the office that makes sure the website is updated, makes sure that students on campus know what services are offered at the medical center, the Tang Center we call it. And then we have somebody from SHIP in that meeting, which is really great. So SHIP is the Student Health Insurance Plan, and that's really key to have her there because she keeps us up to date on what's covered in terms of the medical interventions, and she also keeps us up to date about what surgeons are wanting and what surgeons are taking student health insurance at that point and the access to those surgeons. And she'll actually meet one-on-one with students to help them too. And then we have someone from administrative services who helps us, know what's possible. Like we had these great ideas, but she has an understanding of the admin side of the building, and then we bring in IT as needed for things like, a lot of this team to date, so far, in our development has been putting out fires, quite honestly. So students will come to us and say, I'm getting misgendered and misnamed in the waiting room, it's very invalidating, it's very embarrassing. And so we'll talk about, okay, well, how can we set up the medical chart, and how can we tweak PMC, our medical chart, so that when the student comes in, they get called the right name and the right gender. And that's something that a couple of our primary care docs and the IT department really figured out how to do that. And the website is a really big deal too, because that's where students go first. So we're constantly updating our website. So any question that you probably have about our services, you could probably find on our website right now. We're really into our website. And we're really proud of it. We just put a page up for parents and families, actually, because we had a lot of parents calling and saying, what is going on up there at Berkeley? My student left home as a female and came back for Christmas as a male. What are you doing? We had an influx of calls like that. And so now we have a page on our website specifically geared for information for parents and families. And so that's kind of what that meeting is. And we meet every other month. And then we have our clinical care team. These are the folks that actually meet with students. So these are, this is a really cool team because it's really interdisciplinary case consultation is really what it is. So we have the MDs and the nurse practitioners who are prescribing hormones. And then we have our social worker, some psychologists that are providing therapy and providing letters. And the conversations that we have, so it's kind of like training and case consultation. So you might be wondering, how do they have time to have all these meetings? This is like a brown bag over lunch, training and consultation. It sort of flip-flops. And we have training from one of our MDs is an expert nationally on trans issues, and she's been providing us training about surgeries and all the medical stuff, that especially the counseling side, we're like, well, what happens actually when you take a hormone? What happens to your body? What kind of surgery? So we're getting a lot of information about that. And then also this interdisciplinary case consultation. So, what are the psychosocial factors that might be impacting the process of transition if someone is actually transitioning medically? The MDs and the NPs often only have like 15 or 20 minutes to meet with a student, but we have 45 minutes, which sometimes to us feels short, but to them feels like, that we have this luxury time. And it's really true. We usually know what's going on psychosocially, whereas, the student might just come in and is not being med compliant. So we can have these cross-discipline conversations. And then the mental health team decided that we wanted to meet independently. And so we've been doing that for a year and a half or 2 years. Again, we're sharing with you where we are in our developmental process as a team. And what we've been doing so far, actually, is just figuring out what we're doing. We've been meeting and talking about what are the services that we want to provide. We have a brief counseling model. What can we do in brief counseling in terms of providing letters? How will we know if we can actually do a letter? And you'll see when we go through the chart, we have a whole table that outlines whether or not the student is a good fit to be assessed for a letter in-house or outhouse? No, off campus. Yeah.
Do you involve off-campus therapists who might be involved doing the longer-term transition?
Yes, thank you for asking that. Yes, we do. We are currently really working hard. Tobias is sort of leading this to have close relationships with the therapists in the community, because a lot of times they'll say they have experience with trans, or they'll say LGBT, but we really want to know who the providers are who actually do really thorough assessments for letters. And so right now we're actively working on forming closer relationships with those people. And yeah, if we go through our chart and we realize this, and this happened to me twice last year actually, I went through the whole assessment that you see in front of you, and at the end I brought it to the team and I was like, I don't know about a letter, and we decided to have these people go off campus. Then we'll actually help the student make that connection, and we're hoping to get them connected to people that we know, who we know can do letters as well. So up to this point, basically what we've been doing is creating this document that you see, trying to figure out what services we can provide and when we should refer out. And now what we're doing is we're really transitioning into really starting to assess this, right? So we think it's a good idea. It has a lot of pieces from Davis, what's going on at Davis, which we feel really good about. And we've been reading and talking to people who've been doing this work for a long time. So now we've got this document. And now what we're doing is we're really assessing our assessment. We're really testing ourselves and having conversations about what's working in it and what's not. And that's kind of where we are. Did I miss anything? Referrals you mentioned, and we also provide consultation to the rest of our staff who might not have as much experience in these issues when needed. And we meet every 46 weeks. And this is our team. This is our beautiful team. So I think we said we have a social worker, 4 psychologists. Oh, and Molly Anderson on the end is a nurse practitioner. She's represents a psychiatry department, which is also housed in the counseling center. And she's just so valuable to us because she's often seeing a student for meds, and then we're seeing the student for counseling. And so she's learning about how medications might be impacting hormones and how those things play into the whole physical picture. And so she's in that meeting as well. So this is the mental health team. Any questions about sort of how we structured? Yeah.
I have a question about if you, as a team, have a position or policy. I understand that there's an issue about even needing a letter. You know, the idea that you've got to pass somebody else's scrutiny to pursue what you feel you need that idea, whatever. As far as the awareness and sensitivities and community experience seems to be connected to that. So how do you, as a team, at the same time that you're working on, are we going to do letters, what is required, et cetera, address or respond to thoughts and feelings about why you can do this, or something like that?
Yeah, and it makes a lot of sense. Yes, we have that conversation a lot, and it makes a lot of sense to me because some students come in and they say, I know who I am. I have a physical problem. I don't have a mental problem. I have a physical problem. I need changes in my body, and yet I have to go to a therapist to make sure that I'm mentally sound. And I can understand that's very offensive. Likewise with diagnosing, we have conversations about that too. But right now, the way we're structuring it is really what's required. So our goal is to help students get where they want to go, help them figure out where they want to go if they need that, and then help them get where they want to go. And right now, surgeons are requiring letters. So that's kind of where we're gearing it. We actually do not require letters for hormones. Because our team works so closely together, our MDs and NPs who are prescribing hormones in-house do not require letters from us. So that's great. Now, if a student wants to use a different health insurance and go off campus, oftentimes those doctors will want letters, and so we will write a letter for hormones. But right now, what we're doing basically is what is required from the MDs providing these procedures. And there's actually a table about that in your packet too, about how many letters are required and how it differs from the WPATH standards of care, which Tobias is going to talk about, which is sort of the international standard for what is the standard for care for transgender people, both mental and physical health, and then what's required from SHIP, which is sometimes a little different. All right.
I really appreciate the comment that you made, because I think one thing, as I've become a member of this team, that was one of the first things I was thinking about, because I connected it to my marginalized identities and how many hoops I feel like I have to jump through just to get, on par with other people in my life. And I think that's one thing that we are really upfront with students about at the beginning of the assessment, is saying, of really checking out, how does this feel to even need to go through this process, and what can we do to make it as smooth as possible. And a lot of times the students recognize, they've read, they know WPATH, standards better than we do, and they're like, I know this is what I have to do, but can we, let's just get through this. But I think that's something that we don't ever want to forget, that we are kind of holding this position of power. So really briefly, going through the medical services that are provided in-house, which I feel like we've covered, but primary medical care and consultation for our trans and gender non-conforming students, hormone replacement therapy, referral for medical services outside of campus. That can even include whether people want to do voice coaching, laser hair removal. Even though some things are covered by our insurance, we kind of know who to refer people to. And then letters in support of surgical procedures, so our doctors can also write those. Yes?
Where are you referring for financial support for students for some of these procedures? That came up with one of my students recently, and the question went, we actually have one of our financial aid advisors here about, what can be covered through budget increase for financial aid, what's kind of elective, what's really, and going into that place of trying to judge these things, which feels really not right. I think it's uncomfortable. I'm just curious.
Yeah, absolutely. And sometimes we don't have good answers for that. We just help people brainstorm how they can make it happen. But I do know we have a couple of really great clinics. We have the UCSF Center for Transgender Excellence and the Lion Martin Transgender Health Center in San Francisco. And they have really comprehensive services that we refer students to sometimes if they can't get things with our insurance, or if they're graduating and want to know how to continue their care. But yeah, it's a huge issue, because there's certain things that insurance companies would decide as cosmetic, you don't really need that to be X, Y, Z, but it feels really salient to a person's identity. And that's why it's great to have somebody on the insurance panel working with us, because we really talk back and forth with what do we need to show the insurance company to get this covered. What routes can the students take to really advocate for this? In what order should they advocate for things? Like which things are going to be harder to get approved by insurance, and what things might be a little easier. And so we have those exact conversations, but sometimes there's no good answers, and we just help people brainstorm about what resources they can find. And sometimes emergency loans or things like that from financial aid. But yeah, I feel like that's probably an issue across the board. Counseling services. So the packet that we have talks about assessment for letters, but of course, if a person is coming in as transgender and gender non-conforming identified and don't really need a letter, we provide brief treatment for them. And something I've advocated for in my unit is to be able to do long-term work with a few students just for training opportunities. And so I just finished working about a little under 2 years every week with a student, and it was just a really, really powerful experience to work with somebody through the other things they came in to talk about and their gender identity development. And so that's one thing I would really advocate for, even in the brief model, if you can at least have one opportunity to work longer with a student and really get a sense of some of the things that come up over time. So we do assessment for letters, consultation with each other, which is huge and so important. So when we have our meetings, a clinician might say, can I step into the meeting because I want to talk about a case? And so we make time for that. And we provide resources for students and other clinicians. All right, so let's go to the packets real quick. I'm not going to read it line for line, but I do want to go through it. There,
We can
at least
email
one or
it to
two
you.
copies in the back to Igor.
We might have to share for now, but we can definitely, we realize that we only have a few minutes left. We're aware of the time, but at the end, we'll have our email and we can email them to you, but we're hoping to just go through the highlights of it. Is there any way we can just spread them around over here and maybe share a little bit? Here's one more.
Yeah, we underestimated our attendance today. We're so glad you're here. So again, this is a model for assessment for letters. I think it definitely informs how we work with the students in general, but really this is for deciding whether we can write a letter in support of gender transition surgery, called many different things, sex reassignment surgery, gender confirmation surgery, or for hormones that happen in the community. So step one, and you'll see them kind of outlined in the document, is to determine the appropriate service provider. Sometimes that can just be who on our staff related to demographics and who a student's comfortable with will be the right provider for them. But then it's also asking, can we do this in our brief model? You know, can we with 3 to 4 to 5 sessions really adequately assess, you know, whether we can write a letter in support for the student, or are there other things that need to be considered? And related to that, there's a chart in the packet that kind of says, you know, shows you people that we can support in-house and the things, the criteria that we look at, and then reasons why we would refer somebody out to the community for assessment. And then so if we decide, yes, this is a person that we can see in-house in our brief model for a few sessions of evaluation, then we have our assessments that we go through. And you can see that, like all the different criteria we kind of cover in that. Pull that really quick. Okay, yeah. So we just ask about a person's psychosocial history, their psychological history, gender identity, their experience of gender dysphoria throughout their life. And that can take 2 to 3. I mean, we really tell students that it may take a few sessions, so we encourage them to, you know, be patient with us. And typically they're okay with that. Sometimes they're like, I need to make this happen. And sometimes that can be really indicative, one, of just the fact that they have had to go through all these hurdles throughout their life and they're really ready to be able to express who they are. But then sometimes it can be a sign that, like, of other things. So there's one student we worked with who doesn't have really good support from family or friends, but was like, I really want to make this happen. We're like, you know, this is an opportunity for a little education on how serious these surgeries are and how long it can take to rehabilitate from them. And so it's an opportunity to also provide a little education and say, you know, these are the kind of things that we believe you need to be able to heal and just to take care of yourself medically. And if we're trying to rush that process, sometimes it just gives us pause and say, okay, well, tell us about the reason you want to really make this happen, besides the fact that you're ready to live as a person you are. And that's where consultation is so important, because there are times where people have medically unrealistic expectations about what is possible or not possible. You know, and that's really hard, because I feel like we're gatekeeping, but also we're trying to keep a person safe medically. So it's not so much about their psychological process, it's about, you know, what it takes to make some of these surgeries happen. And so after the clinical assessment, if we feel like, okay, we're ready to write this letter, then what we do is bring it back to our team and say, okay, we went through all these things, and we just want to get feedback from the team, and the team will ask questions like, what do you think about this, or what about this part? And then once we feel good about that, we write the letter. We can bring that back to our colleagues to consult. We go over it with our students to make sure that they feel good about the language and everything's up there. And then we typically give a copy to the student and then a copy to the insurance office, which we have to get releases of information signed for that as well. And so in our document, you'll see sample letters using various types of language, depending on what works for you or what works for the student. This whole process was definitely informed by, you know, what we learned from the UC Davis model, also informed by WPATH Standards of Care version 7, also informed by, you know, consultation with each other, and just by other things that we've been able to glean from trainings. We had Lynn Fraser, who was a former president of WPATH, come talk to us. And so we were really seeking that consistent continuing education and training to make sure that we are, you know, assessing our assessment. So yeah, so this is a long document that I really condensed very quickly, but that's kind of the general outline of what happens. Then it's really important for us to make sure that we on our team and clinicians in our building have good resources. So WPATH Standards of Care is a great resource that we encourage everybody who's going to work with transgender and gender nonconforming students to read through, because it's really, really important information. Also, the Association for LGBTQ Issues and Counseling has documentation on like working with trans and gender nonconforming students. And APA guidelines are in development for working with transgender and gender nonconforming students.
You can get the whole standards of care booklet online.
Yeah, free PDF. So, yeah.
Do some insurances require a set number of sessions or length of treatment, or is it just enough to get a letter that support it moving forward?
Yeah, it's typically in the direction of enough to get a letter. Like they don't identify how many sessions or how long the assessment has to be. I know formally, I think even the Standards of Care had, as far as a person living in there, expressing their desired gender, and they used to have a kind of a time on that. But we're moving away from that too, and just looking at a person having a significant amount of time, at least a year, really embodying who they want to be. But sometimes, you know, with students, they're like coming to understand this and to really express this once they get to college. So we really take it case by case basis. You know, we're not gonna say, okay, wait till next year, and then we'll make this happen. But we really look at all those assessment factors to figure out what's been happening in their life up to that point. And whether this seems like a decision influenced by other things, or whether it's something that seems really authentically generated.
I'm aware of the time. I know we're a few minutes over, so if anybody needs to leave, we understand that. And we're basically at the end, but we do want to hear, if you have time to stay for a few minutes, we would like to have more of a little bit of a conversation about and hear what others